which is the best type of toothbrush for you. Do you know that? Hi everyone, welcome back to my channel. So you know what, a lot of patients who come to my clinic, they always ask me which is the right kind of toothbrush for them. So there are a lot of toothbrushes which are available in the market. So out of those, which are the ones which is ideal for them? So now when you look at this, you have 4 different type of toothbrushes available. So the first one is the ultra soft one, then you have the soft, then you have medium, and then you have hard bristled one. So the bristle refers to the tip of the toothbrush, you know, those things which are there which is used for cleaning. So now what happens here is that most of us from a long time it has been told that, or we have believed that the harder the better, but that's absolutely wrong. I don't think harder is the better, at least in case of tooth it's not at all good. So the ideal toothbrush for you would be a soft one. There are certain people who need to use the ultra soft one as well, because if their gums are like very sensitive and they have undergone some gum surgeries, then maybe they need to use the ultra soft one. Otherwise, the soft toothbrush is the one which is recommended for almost all of you. The medium and the hard ones, they are like, you know, the bristles that are present, especially the hard ones, they are very hard. And even though tooth is like one of the hardest structure in your mouth, it does not mean that it requires a brush like that for cleaning. So whenever we brush, it's not just the toothbrush bristles that applies the force. We are not actually doing it very tenderly, right? So the force that we are giving in order to brush your teeth also matters. So what you need to do is that a gentle pressure is more than enough with an ultra soft toothbrush for cleaning your tooth surfaces. So the tooth is a hard structure, but you should remember that the surrounding tissues which are present, the gums, they are very soft structures. So the bristles, what they actually do is they not only clean the surface of the tooth, they also remove what is the dirt that is present in between the tooth and the gums. So the gum, being a softer tissue, requires an ultra soft toothbrush to be used. So the American Dental Association has already laid down the guidelines for a toothbrush. So the head, the size of the head, the length of the toothbrush, the width of the brush, the number of bristles in each row, everything has a guideline. But of course, it's not possible for you to buy a brush and sit and count how many number of bristles are there, right? So what you need to just make sure is that just buy a soft toothbrush, preferably, and use a very gentle pressure when you're applying for brushing your teeth, just enough to to blanch the surfaces, and you need not do it very hard and be very harsh with it. See, even I had believed that the harder you brush, the longer you brush, it helps, but that's not right. You need to brush only for like 2 minutes or so and apply very gentle pressure. Be good with the tissues, because they are not just the hard ones, they are softer tissues as well. Along with that, what you need to also see is that a harder toothbrush will cause gum recession. When you're using it for a very long time, because of the force that the bristles are putting as well as the force that we are putting, it will cause recession of the gums and detaching of the gums from the tooth surface. So that, as you all know, if the gums are not strong enough, then the tooth does not stay strong. So unknowingly, even though you're trying to clean your tooth, what you will be doing is ending up in having gum recession, and also it can cause micro abrasions on the enamel surface of the tooth. As you all know, enamel is one of the hardest structures, but still, since brushing is something which you're doing morning and evening and for continuously for years, right? From the time you are 3 years old, you start brushing your teeth. So when on a long run, it causes micro abrasions on the enamel surface, and when it becomes more, it can also cause erosions on the surface as well as a lot of sensitivity. And sometimes patients who brush very hard for a very long time, they actually have a generalized sensitivity. This happens because of the loss of enamel which has taken place. So when you're brushing, just remember that you need to apply just a 2-finger pressure, not the whole, the whole fist is not required for you to brush your teeth. You just need to apply the 2-finger pressure. Do it gently. And if you're not so happy with it, maybe if you're not able to identify the right toothbrush for you, the dentist is the right person to whom you can ask about this. They might be able to help you with the customized one for you, like not make a customized one, but seeing the oral cavity, your oral conditions, they might be able to help you choose a better one. Along with that, There is electric toothbrush which can be used if you are confused about applying the right amount of pressure and applying the right technique of brushing. What you can do is you can buy an electric toothbrush which is actually having all the specifications of what is ADA has recommended, as well as the pressure that it creates, the timing of brushing, everything can be adjusted in case of an electric toothbrush. I'll be doing another video on electric toothbrush and how to use them. Make it faster. So just use an ultra soft toothbrush with gentle pressure. The bristles are good enough, they are elastic, they have the capacity to clean the tooth surfaces. And so if you are a person who already have gum recession, be very careful, use an ultra soft brush. And if you are a person who do not have any problem at all, still use a soft toothbrush. That's all for now. Thank you guys.